Hello, Golden Vitality family. Have you ever wondered if masturbation is safe for seniors, or maybe heard old myths claiming it's dangerous? Well, today we're setting the record straight with doctor-approved facts about how it affects your senior health, from stress relief to better sleep. We'll tell you what's real and what's outdated nonsense. Stay tuned, you'll be surprised. Hello and a very warm welcome from all of us here at Golden Vitality. We're truly glad you're joining us today. We believe that navigating our later years is a journey rich with wisdom, experience, and continuous opportunities for well-being. Part of that journey involves feeling comfortable talking about all aspects of our health, even those subjects that might feel a bit private or haven't always been discussed openly. Today, we want to gently address a question that sometimes causes concern. Is masturbation dangerous for older adults? Our purpose is to provide clear, reassuring information based on current medical understanding, helping you separate fact from fiction and feel confident about your health choices. As always, while we aim to offer helpful insights, this conversation is for general knowledge. Your own health situation is unique, so please do talk with your doctor or a trusted healthcare provider for personalized advice. They are always your best resource. Life in our 60s, 70s, 80s, and beyond often brings a different rhythm, doesn't it? We might find profound satisfaction in nurturing our gardens, seeing life spring forth from the soil. Perhaps it's the pure joy reflected in the eyes of our grandchildren as we share stories or play games. Maybe we find purpose volunteering at the local community center, sharing our skills and experience. Or perhaps we relish the quiet companionship of a good book or a peaceful walk outdoors. These activities nourish our souls and contribute immensely to a life well lived. Alongside these fulfilling experiences, our physical selves continue to be an important part of our story. Our bodies naturally change over time. That's simply part of life's tapestry. Joints might communicate with us more frequently. Energy levels might ebb and flow differently. And our reflections show the map of years lived. Yet, beneath these surface changes, the human capacity for connection, comfort, sensation, and yes, pleasure, often remains a vital part of us. Unfortunately, for generations, conversations about sexuality in later life were often hushed, leading to many myths and misunderstandings. One persistent, yet inaccurate notion is that sexual feelings or the need for physical release simply disappear with age. Another, perhaps more concerning, is the lingering question or fear that certain sexual expressions, like self-pleasure, masturbation, might somehow become harmful or dangerous as we get older. Let's first gently clarify what we mean by masturbation. In simple terms, it refers to touching one's own body, particularly the genital areas, for pleasure, often leading to sexual arousal and sometimes orgasm. It's a private, personal activity that people of all ages and backgrounds may engage in. Whether they have a partner or not, it's recognized by doctors and health professionals as a normal aspect of human sexuality for many individuals throughout their lives. Now, let's directly address the heart of the matter. Is masturbation dangerous for the elderly? Based on current medical knowledge and the consensus within the health community, the answer for the vast majority of older adults is a clear and reassuring no. For most seniors who are generally healthy or managing stable chronic conditions, masturbation is considered a safe activity. It is not inherently dangerous simply because of one's age. Where do the fears about danger come from? For centuries, unfounded myths and old wives' tales circulated, causing unnecessary anxiety. You might have encountered beliefs claiming that masturbation could lead to serious problems like blindness, insanity, physical weakness, debilitating fatigue, infertility, or other dreadful conditions. Let us state this unequivocally. There is absolutely no scientific or medical evidence to support any of these historical claims. These ideas stem from outdated social taboos, moral anxieties, or a lack of understanding about human physiology, not from medical fact. They belong to the dustbin of history, not to informed conversations about health today. From a purely physical perspective, the act of self-pleasure is typically benign. The body undergoes natural physiological responses during sexual arousal and orgasm. Heart rate increases, blood pressure rises temporarily, breathing quickens, muscles contract, and various hormones and brain chemicals like endorphins and oxytocin are released. These responses are generally well tolerated by a healthy body. Think about the physical exertion involved. For most people, it's often comparable to mild or moderate activities like climbing a flight or two of stairs, taking a brisk walk, or doing some enthusiastic gardening. If your body is generally healthy enough for those kinds of activities, it's typically healthy enough for the exertion involved in self-pleasure, understanding potential risks and when caution is sensible. While masturbation itself isn't inherently dangerous due to age, like any physical activity, there are specific situations, primarily related to underlying health conditions, where caution is wise or where it's essential to consult with a doctor. It's crucial to understand that these concerns are usually related to the exertion involved or specific health circumstances, not to the act of masturbation itself being uniquely perilous. Let's explore these specific contexts with care. Severe or unstable heart conditions. This is perhaps the most important area where caution is warranted. If you have been diagnosed with serious heart disease, such as unstable angina chest pain that occurs unpredictably or with minimal exertion, uncontrolled high blood pressure, certain types of irregular heart rhythms, arrhythmias, severe heart failure, or if you have recently had a heart attack or heart surgery, any activity that significantly increases your heart rate needs careful consideration. Sexual activity, whether partnered or solo, does place a temporary demand on the heart. What this means, it doesn't automatically mean masturbation is forbidden, but it does mean you absolutely must talk to your cardiologist or primary care doctor first. They understand your specific heart condition and can advise you on what level of physical exertion is safe for you. They might perform tests or evaluate your stability. Think of it this way. You would ask your doctor if it's safe to start swimming laps or join a walking group if you have a serious heart condition. The same principle applies here. It's about ensuring the exertion level is appropriate for your specific cardiovascular health. Your doctor's guidance is paramount. For most people with stable, well-managed heart conditions, moderate exertion is often fine, but only your doctor can confirm this for you. Recovery from recent surgery. If you've recently undergone surgery, especially procedures involving the abdomen, pelvis, groin, spine, or heart, your body needs time to heal. Straining muscles, increasing abdominal pressure, or engaging in vigorous activity too soon could potentially interfere with healing, cause pain, or even lead to complications like reopening an incision. What this means: always follow your surgeon's post-operative instructions regarding physical activity restrictions. These guidelines usually specify when it's safe to resume various levels of exertion, including sexual activity. If you're unsure, ask your doctor directly during a follow-up appointment. Gentleness and patience are key during recovery. Risk of physical injury if not careful. While the act itself isn't inherently dangerous, there are ways one could inadvertently cause minor harm if not mindful. Being too rough, applying excessive force or friction, especially to sensitive genital tissues which can become thinner or more delicate with age, particularly for women after menopause, could lead to skin irritation, soreness, bruising, or small tears, microabrasions. Solution practice, gentleness, and listen to your body. Use lubrication if needed. More on this later. Using unsafe objects. Inserting foreign objects not designed for sexual use into the vagina, anus, or urethra poses significant risks of injury, infection, or objects getting stuck. potentially requiring medical intervention. Solution Home: use your clean hands or devices specifically designed and sold as safe for sexual stimulation. Sex toys, and ensure these are kept clean. Uncomfortable positions. If you have arthritis, back pain, or other musculoskeletal issues, certain positions might strain joints or muscles, leading to pain. Solution: experiment to find in positions that are comfortable for your body. Use pillows for support. Focus on gentle touch rather than awkward contortions. Poor hygiene. As with any activity involving touching intimate areas, basic hygiene is important to prevent the introduction of bacteria that could lead to infections, such as urinary tract infections, UTIs, or skin infections. What this means: simply washing your hands thoroughly with soap and water before and after self-pleasure is usually sufficient. If using any devices, clean them according to their instructions. Certain skin conditions. If you have an active flare-up of a skin condition affecting the genital area like lichen sclerosis, psoriasis, or eczema, friction or touch might exacerbate irritation or pain. What this means: you might need to be extra gentle. Use specific emollients or prescribed creams as advised by your doctor, or potentially avoid direct stimulation of the affected area during severe flare-ups. Again, consulting your doctor or dermatologist is wise if you have such conditions. It's important to reiterate these potential risks are generally manageable or avoidable with awareness, common sense, gentleness, good hygiene, and crucially, open communication with your healthcare provider, especially if you have significant underlying health issues like severe heart disease. The danger doesn't come from masturbation itself in a healthy individual, but rather from how any physical activity interacts with specific health vulnerabilities or from unsafe practices, moving beyond fear's safety, normalcy, and potential benefits. So, having addressed the specific situations where caution is needed, let's circle back to the main point. And for the vast majority of older adults, masturbation is a safe and normal activity. The persistent myths about it causing serious harm are simply untrue. In fact, instead of being dangerous, health professionals increasingly recognize that maintaining sexual expression, including self-pleasure, can potentially contribute positively to overall well-being in later life. Think of it less as a risk to be feared, and more as a natural aspect of life that might even offer some gentle advantages. A natural stress reliever. Remember those endorphins and oxytocin released during orgasm. They are powerful natural chemicals that promote relaxation, reduce stress hormone levels, cortisol, and create a sense of calm and well-being. In a world that can sometimes feel stressful, having a built-in natural way to unwind and release tension can be incredibly valuable for both mental and physical health. Think of it as hitting a natural reset button for your nervous system. A gentle sleep aid. The profound relaxation and hormonal shifts following orgasm can make it easier for some people to fall asleep and perhaps sleep more deeply. If you struggle with occasional insomnia or restlessness, finding a natural way to prepare your body and mind for sleep can be a welcome relief. A natural mood booster. The release of endorphins and dopamine, the pleasure chemical, can provide a temporary lift in spirits, helping to combat feelings of low mood, anxiety, or loneliness. Finding moments of pleasure and satisfaction is important for emotional resilience at any age. Connecting with your body. Self-pleasure offers a way to stay connected with your own body, understand its sensation, and appreciate its capacity for pleasure, regardless of age-related changes. This can foster a more positive body image and sense of self-acceptance. Maintaining pelvic floor tone, especially for women. The involuntary muscle contractions during orgasm provide a gentle workout for the pelvic floor muscles, potentially helping to maintain bladder control and support pelvic organs. Potential prostate health association for men. While more research is needed, some studies suggest a possible link between regular ejaculation and reduced prostate cancer risk, perhaps by helping to clear fluids from the gland. Remember, this doesn't replace screenings, a safe outlet for those without a partner, or whose partner is unable or unwilling to be sexually active. Masturbation provides a safe, private, and readily available way to express sexual feelings and meet needs for physical release. Seeing these potential upsides helps reinforce the medical view that, far from being dangerous, self-pleasure is generally a healthy and normal part of human experience for those who choose to engage in it. The wisdom of listening to your body and using aid. A key aspect of ensuring safety and comfort, especially as we age, is tuning into our body's signals. Just as you wouldn't push yourself to lift something too heavy if your back felt strained, or garden for hours in the hot sun without water. Being mindful during self-pleasure is important. Pay attention to pain. Pain is a signal to stop or change what you're doing. Pleasure should feel good. If something hurts, be gentler. Change position. Use more lubrication. Or take a break. Embrace lubrication. This is particularly relevant for postmenopausal women due to lower estrogen levels. Vaginal tissues often become drier and more delicate, a condition called vaginal atrophy. Attempting stimulation without adequate lubrication can easily cause discomfort, friction burns, or tiny tears, making the experience unpleasant and potentially leading to infection. Using a good quality water-based or silicone-based lubricant readily available at pharmacies is not a sign of failure or dysfunction. It's a smart, simple solution that dramatically enhances comfort and safety, allowing for pleasurable sensation without irritation. Think of it like using moisturizer for dry skin. It just makes things feel better and healthier. Men might also find lubricant enhances comfort and sensation. Consider assistive devices if arthritis in the hands, limited reach, or other mobility issues make self-touch difficult. Don't assume pleasure is impossible. Specially designed personal massagers or vibrators can be very helpful. They come in various shapes and sizes, some with ergonomic handles, making them easier to hold and use. Ensure they are made from body-safe materials like medical-grade silicone and are kept clean. These tools can provide stimulation effectively and comfortably when direct hand contact is challenging. Emotional safety matters too. While our focus has been on physical safety, emotional well-being is equally important. If engaging in masturbation brings up overwhelming feelings of guilt, shame, or anxiety due to deeply held personal, cultural, or religious beliefs, then forcing yourself to do it wouldn't be emotionally healthy, even if physically safe. Respecting your own values and conscience is paramount. True well-being involves feeling good both physically and emotionally about your choices. If these feelings stem from old, negative messages you wish to overcome, talking with a therapist or counselor might be helpful. But if they are rooted in your core values, honoring those values is essential for your peace of mind. Your doctor, your confidential health partner. We cannot emphasize this enough. Your doctor is your ally in health, and that includes sexual health. Please don't feel embarrassed or hesitant to discuss concerns related to sexuality, including masturbation, with your healthcare provider. They are trained professionals who deal with these topics regularly and confidentially. Bringing up the subject might feel awkward at first, but it's important, especially if you have significant health conditions, particularly heart disease. You've had recent surgery. You're experiencing pain during sexual activity or self-pleasure. You've noticed significant changes in sexual desire, function, or sensation. You have questions about how your medications might be affecting you sexually. You simply want reassurance about safety based on your personal health profile. Your doctor can provide accurate information tailored to you, rule out underlying medical issues, adjust medications if needed and possible, recommend helpful solutions like lubricants or physical therapy, and offer peace of mind. They can help you understand what's normal for you and how to navigate any challenges safely. Remember, sexual health is a vital part of overall health and quality of life, and it deserves the same level of medical attention as any other health concern. In conclusion, knowledge empowers safe choices. So, let's revisit our initial question. Is masturbation dangerous for the elderly? For the great majority of older adults? The answer, supported by medical understanding, is no. The historical myths suggesting otherwise are unfounded. It is generally a safe, normal, and potentially beneficial activity. The key takeaway is that safety is primarily linked to your overall health status in practicing common sense, rather than age itself being a barrier or risk factor. The situations requiring caution, severe heart conditions, recent surgery, risk of minor injury if not careful, hygiene, are manageable with awareness and, crucially, open communication with your doctor. Understanding that masturbation is not inherently dangerous can be liberating. It allows you to make choices based on facts, not fear. It empowers you to potentially embrace an activity that might offer benefits for stress relief, sleep, mood, and self-connection. Should you desire, it aligns with the values of personal freedom and the pursuit of well-being throughout our entire lives. Ultimately, the choice is always yours. Whether or not you engage in self-pleasure is a deeply personal decision based on your desires, comfort level, and values. There is no right or wrong answer that applies to everyone, but knowing that from a safety perspective, it is generally considered benign for most seniors can help you make that choice with confidence and peace of mind. Thank you for exploring this important topic with us here at Golden Vitality. We hope this conversation has provided clarity, reassurance, and helpful information. Your health journey is unique, and feeling empowered with knowledge is key to navigating at it well. If this discussion has raised personal questions or concerns, especially regarding your specific health conditions, please do make an appointment to chat with your doctor or another trusted healthcare provider. They are the best people to provide guidance tailored just for you. Be well, stay informed, and continue to embrace a life of vitality and fulfillment.